Any treatment approach needs to have a good look at the current evidence that is available around us. But we need to take a specific precaution on this particular way of looking at our clinical decision. The evidence, according to me, or my opinion, should be looked at two ways. One is evidence-based practice, where there is a general consensus about how a treatment approach is effective in producing results. And another approach is practice-based evidence. As we know, as human beings, we are all not the same. So the evidence that was found cannot be applicable to every single individual. So it's the decision of the clinician to say, how do I use the evidence and how do I apply the practice or the clinical experience that is gained by my practice and join them together, and then I could decide a very good treatment option that is available for my patient. But it is imperative also to see what is the evidence available. Let's have a look at one or two articles, which is a systematic review, to say how or whether aquatic therapy is effective in conditions like osteoarthritis.
I'll just touch two articles related with osteoarthritis and aquatic physical therapy. The first one, Aquatic Physical Therapy for Hip and Knee Osteoarthritis, are results of a single-blind randomized controlled trial published in Physical Therapy Journal. The authors were Arana S. Hinman and Sophie Haywood. The purpose of the study was to evaluate the effects of aquatic physical therapy on hip or knee OA. The participants who were randomized received 6 weeks of aquatic physical therapy or no aquatic physical therapy. The outcome measures included pain, physical function, physical activity levels, quality of life, and muscle strength. After completion of the study, it mentioned, compared with no intervention, a 6-week program of aquatic physical therapy resulted in significantly less pain and improved physical function, strength, and quality of life. But it is unclear whether the benefits were attributable to intervention effects or a placebo response. As I mentioned earlier, every evidence has to be looked and thoughtfully, and a clinical decision has to be taken with the clinical experience of the therapist. The other article is a systematic review with meta-analysis, effect of therapeutic aquatic exercise on symptoms and functions associated with lower limb osteoarthritis. The authors were Benjamin Waller, Anna, Manuel, Johan Lambach, Daniel, Oro, and Ari. This is a good article to have a reference because it gives you a whole list of exercises being, or let's say whole level of intervention that was being performed by different therapists. The results indicated that the therapeutic aquatic exercise was effective in managing the symptoms associated with lower limb OA. I would suggest further reading of evidences before you make a final conclusion about how aquatic therapy is effective in treating osteoarthritis.
Well, we looked at the evidence. Now, we have to look at what are the ways in which exercises can be performed.